audience.
Thank you. My name is Roland Verstappen from Heineken. Thank you very much for your presentations. Very interesting. I just wanted to know, because all the presentations talk about beer, but is there a difference between alcoholic beer and non-alcoholic beer in these discussions or not? On polyphenols, for example.
Yes. Sorry, the question what would be?
You were kindly giving us the data on the impact of polyphenols on cardiovascular disease.
Yes.
And my question is that the same for alcoholic beers or non-alcoholic beers?
Well, this could be a better question for Dr. Struck, because we have been, well, but he has been the main author of a study to evaluate the effect of beer with ethanol and without ethanol, no? And both beers have an effect on health, no? They have different, well, you could explain better than me.
No, but he is asking about the biomarkers of non-alcoholic beer.
Sorry, I have not understand very. Yes, we in this study. Sorry about that. In this study, we have also evaluated. I have not presented the results. If isoxanthumol was a good biomarker of non-alcoholic beer, I have the data of that, and it's also a very good biomarker because it's also present in non-alcoholic beer.
Okay.
Thank you very much. Oluma Lomo from Bells University of Technology in Nigeria. And this tour is being sponsored by Nigerian breweries in Nigeria. My question is to Dr. Zacconi, who spoke on celiac disease and beer. You gave us the impression that if you use cereal other than barley, especially, let's say, sorghum, you reduce the risk of these celiac diseases. But incidentally, if you look at sorghum per se, you look at the anatomical structure of sorghum, it's difficult to brew beer, a very good beer, like you're a brewer, a very good beer from sorghum malt compared to barley malt. And where do you cut the divide? Where do you stand? Is it to encourage these other grains other than barley, or to also encourage, I don't know, sorghum, for instance? So that's my question, because it's becoming confused. If you're talking about your health, you want to reduce the celiac diseases, and so you want to go for sorghum. But then, if you really want to brew from sorghum, you find it difficult to brew a very good beer, because you're talking about at the end of the day, free amino nitrogen is very low, and the yeasts, you need to even in the brewing process, in the malting, in the mashing process, you need to complement it with extraneous enzymes, and that's also add to the costs of production of beer. Thank you.
Yeah, you're absolutely right. It is right to substitute completely and to have at the end 200% the same quality like a barley malt beer is not correct. You cannot substitute with sorghum or buckwheat or something like that and have at the end a 100% barley malt beer. The reason is very easy. Since 10,000 years, the people select barley only for one purpose, to make beer out of that. Yeah, and so the barley today is really perfect to that what we define as a beer. That's right. Yeah, a lot of people in Nigeria, for example, as well, started to substitute and have done the right ways to do variety trials and find some good varieties which have a little bit more of free amino nitrogen, have more amylolytic enzymes and so on, which are needed during the whole process. And I think we are on a good way. I can give you some varieties if you want to, the names of it, which are hopeful, I will say like that. But you are absolutely right. Substitute completely that you have at the end the same quality with the foam, with the taste, with the shelf life and so on, like barley malt, is at this stage not possible. Yeah. But these products, it's always the definition of beer, yeah, how you define it to the consumer. It's an interaction. And if you say you produce something new, it has a green foam and the color of the beer is blue, then you define it. And if the consumer will pay for that money, then it's okay. Yeah, it's up to you. And what I have learned is when I use these different cereals and pseudo cereals, a lot of them are really, really interesting. For example, black rice. It has a wonderful color, red, really red. That's a red beer and a wonderful taste. Unfortunately, black rice is not a variety you can get in Europe, for example, but why not using that? Use it in Asia, Southeast Asia, and so on. And this is, in my respect to the research, very, very interesting to create some new beers. Yeah.
There's another question there.
Hello, I'm Lina Badimon from Barcelona. Well, I want to congratulate all of you because it was very interesting. And I have a question for Rosa Lamuela. In your mortality data, if I understood correctly, in the Predimed study, you associated stilbenes, flavonoids, and lignanes with the reduced mortality. Can you tell us if there was any special one of these three families that was most associated to the data you found, to the results?
Yes, well, total polyphenols, in any case, that is total polyphenols consumption, are one of the ones that give better results. But we are very surprised about with lignans, because the consumption of lignan, well, in the case of Spain, is coming from olive oil. But it's really a very active, it's acting really very active. With very low dose, it's doing very strong results. We are really surprised, and we want to future some of our research in lignans.
Yeah, because this was my question, the following question. In the Predimed, you had beer consumers and not beer consumers. Mm-hmm. So have you analyzed the same mortality curves with beer consumers only?
The problem with the Predimed, well, it's a very good study.
Yeah, it's very good.
But no, the problem is that in the Predimed, the beer consumption is really very low. Okay. The people is not, and the same happens with wine. Wine and beer consumption in Predimed are really low. So it's very difficult to differentiate with units of beer in the Predimed. Well, you can do some, but it's not as the typical epidemiological studies.
Thank you. And I have a question for Dr. Fangel, or Fangel, I don't know the pronunciation. I think you presented a very nice method, and I would like to ask you the variability that you have when you repeat measurements with your system, because you are proposing it as a way of identifying the composition of beer for any claims that a company can make regarding beneficial effects, right? In a way, is a system by which you could follow very closely how the beer is manufactured. So what's the variability of your method? I know all arrays you need very, very good standards, but have you measured that? Variability meaning if you repeat measurements with the same beer, which is your coefficient of variation?
The data that I showed had at least, most of them had 5 bottles, and there's very, very little variation between them, at least detectable by this method. They're very much the same. So I guess at least compared to plant samples that I normally work with, these are amazingly close. So I think it's pretty good in the biological replicates, if you can call it that.
Thank you.
There's another question in the third row.
Thank you for your interesting talks. I'm coming from the medical side. I'm a neurologist, so I want to ask a question to Rosa Lamuela. You said for detecting the beer consumption, you can check urinary isosantome. So can we do it routinely? I mean, just in the laboratory case, or if we want to make a clinical study, can we do it routinely? Do you have a routine biomarker for it?
I have not understood.
Yeah, routinely. Can we do
yes,
it routinely?
yes, of course, yes. We're performing it well in 96 plates because, well, usually we work with many samples, no? So yes, we can do it routinely.
Okay,
And it's a good biomarker for beer with alcohol and without ethanol. It's with both. It's a good biomarker for both.
Okay, perfect. So, and also, can we check the amount of beer consumption with this parameter?
The amount, well, we could differentiate if they consume beer or not. If we do a dose response, yes, you can really see very well. It's very proportional to the amount. But I don't know if a very clinical, with a very big clinical study, you could know exactly which was the amount of beer, because it depends a lot. Some beers have more hop, so they have more of these compounds, and other beers have less. So to know the exact amount would be difficult, no?
Okay, thank you.
Sorry, maybe I can say a few words to that. It depends on the technology. And one new beer is the dry hop beer. That means the hop is added during the cold stage. That means the hop is not cooked, not boiled in the kettle, and it is not isomerized. And you focused on the isomerized xanthomol, for example.
Well, we can analyze both.
Yes.
Yeah,
But use it as parameter. It's difficult. You have to know which beer the consumer has consumed. Yeah.
Okay, and there's another question, the last question, just in the middle.
Thank you very much for the presentations. My name is Tola Atimo, a professor of nutrition from Nigeria. Learning that polyphenols and fibers are present in beer, it's very encouraging for nutritionists. My question is there any relationship between the polyphenol content and the shelf life of the beer? In other words, beer stored for months are very likely to still have the same amount of polyphenols.
I answer this question? Yes. Well, I don't know exactly in beer. We have measured in many food, and usually depends on the food, because you are right. Polyphenols are very good antioxidants. As they are very good antioxidants, they get a little oxidized, no? But for example, for the month that a beer is usually consumed, because in 1 year you have more or less a 5% decrease, that is really very small amount, the amount that is decreased. I don't think there is this much difference in one beer that is in storage in very bad condition. But for example, one thing that I think it's important is light. No, light is very bad for polyphenols, so they should try to protect beer from light. No?
Okay, the last one.
Thank you very much. I am a doctor dietitian, Slastin Vladislav. I have a question for you. Is it possible fortification beer with polyphenols and fibers, like bread? Maybe you know fortificate with fibers, or maybe this process for being industrial. To add in beer polyphenols and fibers to increase this level.
What I would do if I was beer making, that I am not a beer making, but I guess this is a question more for him. What I could try is to modify the process, for example, adding hop that is more rich in phenol, or the appending to the malt, can have. What I would do is try to modify or the process to try to increase the phenols in beer. I think that you can play with this, but I think it's better you answer this.
I think that's absolutely right. I would say if we have studies which show that there is an effect, and if we have studies like here 2 to 3 gram per bottle, which is enough for the FDA that you can label it, then you have possibilities during the technology, during the process to enhance that, and you can play with that in a huge range. And so I think it is not necessary to add it. And if you add anything, you have to label it. And that is something what you have to explain to the consumer. And I think that's the main and interesting thing during the process, that you have so many different tools to enhance polyphenols, fibers, and so on, vitamins as well. I have shown you a little bit about other bioactive substances. That's really a nice playground.
Thank you very much.
Okay, thank you very much for the panel. It's fantastic. Congratulations. And now